Immunization is arguably one of the most cost-effective healthcare interventions ever invented. Since the first successful vaccine was developed to treat smallpox in 1796, vaccination has been preventing illnesses and deaths for millions of people around the world. According to the World Health Organization, about 2 to 3 million deaths are prevented each year because of persons taking up vaccines or being immunized. Through vaccination, smallpox was declared eradicated from the world in 1980, and that's a significant achievement. Other diseases are on the verge of being eradicated through the process of immunization here in Jamaica.
Immunization has led to a substantial reduction of illnesses and death from diseases such as polio, measles, whooping cough, and newborn tetanus. Measles deaths have decreased by almost 80% over the past 10 years, which again is a significant achievement.
Jamaica's immunization program has managed to eliminate a number of vaccine-preventable diseases over the years. These include polio, which usually left children paralyzed.
Jamaica had the last case, for example, of polio in 1982. The last case of locally transmitted measles in 1991, the last case of diphtheria in 1995, the last case of rubella in 2000, and the last case of newborn tetanus in 2001.
In 2011, the country recorded 100% immunization coverage for BCG or tuberculosis. Thanks to the expanded program on immunization EPI, which began in 1976, the population coverage against vaccine-preventable diseases remains relatively high. Under the program, immunization coverage for children under 2 years old reached 93 to 94% in 2010-2011. The expanded program on immunization provides free vaccination to children ages 0 to 7 during the routine immunization schedule of the Ministry of Health. This is an integral strategy to reduce child mortality and morbidity.
First, we give at birth up to 6 weeks of age BCG vaccine, which is given usually in the hospital setting, and BCG protects against tuberculosis. At 6 weeks, 3 months, and 6 months, babies are due a vaccine against polio, which prevents poliomyelitis, as well as the pentavalent vaccine or the 5-in-1 vaccine.
Then at 12 months of age, the MMR vaccine is administered to protect children against measles, mumps, and rubella.
At 18 months, we give the first set of booster vaccines, and we give boosters again for MMR. The children get DPT as well, which is for diphtheria, pertussis, and tetanus. And then they also get the polio vaccine at that time as well.
Between the ages of 4 to 6 years, children must get a second booster vaccine for DPT as well as a second booster vaccine for polio.
A lot of these vaccine-preventable diseases are actually quite contagious and can cause death, especially among our young children. And so therefore, I would encourage parents to ensure that their children are appropriately vaccinated.
In Jamaica, children must be fully immunized before entry to school, and that is usually a part of mandatory school medicals due before the start of each academic year.
They have to present the immunization record at the health facility to confirm that the vaccines indeed have been done, and if they are missing any vaccines for whatever reason, then they are provided for them at the health facility.
The immunization record is part of the Child Health Development Passport introduced for every child in 2010 to replace the immunization cards used previously. As part of its public education initiative, the Ministry of Health displays posters and other material at health centers and schools, reminding parents and caregivers about the immunization schedules, showing what vaccine is due and when. Disease surveillance is also practiced at ports of entry to combat the country's increased susceptibility to new diseases due to globalization and increased travel. Across the board, government is on a mission to improve the health of the nation by making traditional vaccines available and exploring new and non-traditional vaccines to tackle other diseases.
For example, the mitigation of NCDs like some cancers which can be prevented through vaccination, such as the vaccine for the human papilloma virus, which causes cervical cancer, falls in line with the Ministry of Health strategic plan to improve the offering to the public. And the commitment today is that we will work to ensure that other vaccines on the market with a proven track record are introduced as part of our routine administration to our population.